What's up, you guys? Hey, I am very excited to start a new series with you called The Standard. What we're doing with this is we're talking about how you progress, how you continually progress, not only yourself, but those around you, and how that ultimately impacts the patient. Be sure you like, share, and comment this video. Looking forward to your feedback and looking forward to sharing more ideas and content with you in the future.
All right, you guys. So we've got our first ever episode of The Standard here, and I brought on a really good friend of mine, Amy. She is coming to us by way of Texas, and I'm here over, struggling in the Virgin Islands. But I did just want to bring, nursing and respiratory together to talk about, how we can improve practice around just revolving around patients. And I really wanted to bring in a nurse, especially this week, especially today, being Florence Nightingale's birthday.
It is.
Yay, right? And we're celebrating Nurses Week. We've been celebrating Nurses Week all week. And today would be officially Nurses Day, correct?
Officially Nurses Day was the 6th, but it
Okay.
always 6th to the 12th, ending on Florence Nightingale's birthday. But this year, it's pretty cool. We get a whole month.
Oh, that's amazing. It's
I
well
know.
deserved. It's well deserved, especially after the time that we've had, the past 18 months or so, and just the grind that all clinicians have been on. I know
Right.
that some of the um, expectations have been elevated for not only respiratory therapists but nurses as well. So
Yeah,
um,
across the
I
board.
absolutely. So I would just want to say thank you for taking some time to come and hang out with me and spend a little time with me. I truly enjoy this and I truly appreciate it.
Well, thanks for having me, JJ. I'm excited.
Yes, yes. So just a little background of what we're trying to do here, what we're looking to do with what this whole show or what this whole playlist is going to be about is just bringing to light some of the ways that we can just make ourselves better as clinicians. Just looking at who you are as an individual and how you continue to get better, how you do that to those around you, and how that ultimately impacts the patient. So one of the first things I wanted to ask, just kind of jumping right into it, is what led you to be a nurse?
Well, that's a heavy question just to start off.
That's like why just like I'm
Jump
baseball
right in.
guy, right? I'm not going to come in and bunt the ball. I'm going to swing for the fence.
Exactly. Yeah.
Let's do it.
Well, so a nurse, about 12 years. And back in the day, I had a few different careers before I went back to nursing school. I wasn't one of the ones that knew, from the beginning, hey, I want to be a nurse. It wasn't always ingrained in me. I've always had a servant attitude and a servant heart, but I did a few other things before I went back to nursing school. And what happened with that was I was feeling a little unsettled in my role at the time. I was doing some managerial work. I was actually a district manager for a children's photography studio. And I was just feeling really unsettled with that and just really felt like I wasn't living up to what my, I don't know if you want to say calling was, or it just didn't feel right anymore to me. And it's an interesting kind of poignant story for me. I have a friend that I went to high school with, and he was working as the CNO at one of the little rural hospitals here in West Texas. And he called me out of the blue. I was living in Austin, and he was in Fort Stockton. And I know that doesn't mean anything to the world, but we just hadn't been in touch with each other in a long time. And he called me out of the blue and was just like, hey, these people from Texas Tech, which is the kind of area university.
It's
They
the
were at
best school in Texas. Red Raider fan here, by the way.
There you go. So they were at his hospital and they were talking about their second degree nursing program. And my friend called me and just said, hey, these people were here today and I don't know why, but you're just on my heart for some reason. And so, I mean, who am I to say throw it in the trash if you're thinking about me? I think that's horrible.
Oh,
And so I said, okay, send it to me, whatever you've got, go ahead and send it over to me. And so he sent it to me and I picked it up in the mail and I just laid it down. I didn't even open it. I was like, oh, this is what my friend Russell sent me. And so I just laid it there. And I'm going to tell on myself with my house abilities here a little bit. But probably like 6 weeks later, I picked it up again and I was like, what is this? And so I opened it up and it was just a bunch of flyers and pamphlets talking about their nursing program and being able to work with people who, who already have a degree and are looking for something different and how they can bridge that gap in order to bring you into the nursing world. I laid it back down again, didn't even really give it a second thought. And that happened once or twice, a couple more times. And then just one day I picked it up and I don't even know why I didn't just throw it in the trash, but I picked it up and just, it wasn't even a thought at that point. It was just a knowledge, a peaceful knowledge that that's where I'm headed next. That's what I'm going to do now. That's where we go from here. And so I had to take some prereqs because it had been so long since I had gone through school time. And then I did that program and here we are.
Right.
Yeah.
How long ago was that? No, don't tell me that. Just kidding.
Well, I've been a nurse about 12 years. So that was probably 14 years ago.
Okay.
Yeah.
That's awesome. It's so cool how somebody else just has this feeling, this thought, right, of somebody that they've known for years, and it led them to a conversation to say, hey, can I send you some information? That information gets sent, right?
Yeah.
And it sits on a coffee table for a couple of weeks, right?
Just a couple.
And then like, it's just sitting there, like staring you in the face, like, hey, pick me, right? And then finally it does. And then this is where we are now. That's so cool. Like,
I almost say that nursing picked me because I don't know that I would have ever considered that on my own. It's a very interesting, and my path was interesting from my viewpoint. It wasn't like I was like, oh, I want to be a nurse my whole life. It is 100% my path. It is my passion. And I can't imagine not doing something with the nursing within a nursing capacity ever again. It's basically who I am at this point. And so it's just interesting to me how I went from not having any understanding or knowledge or no hospital background whatsoever to, oh, I'm going to be a nurse now. And that is 100%. It was, I don't even know how to explain that. It was just this change of heart, this peaceful knowledge, this understanding that it's going to be fine. The path is going to be fine. The difficulties that you're going to have to endure to get to the point where you're going without any experience. I told my dad, I said, Dad, I'm going to nursing school. And he just laughed at me because, I mean, he knows me. He's like, that's not, like, where did that even come from? But today he's like, of course you went to nursing school. There's nothing else in the world you were meant to do. And so it just is funny how those situations come up and how they work to bring you to where you're supposed to be.
Absolutely. I love to say that there's a bigger plan than ours at work.
Oh,
Absolutely.
100%.
And I truly believe that because I was probably in the same boat. Now I didn't have well, I guess my career at a grocery store could be, deemed a career. I worked at a grocery store for about 6 years before becoming a respiratory therapist. That means that they started me at 12. But I really wanted to get into radiology. I'm pretty good with computers and not really a photographer of any sort, but I wanted to get into radiology because I'm good with puzzles and computers and taking those, images apart, spinning them around and looking at them from different angles is something that I was really, really interested in. But then something happened to where that mindset got shifted for me as well. And here I am in respiratory, 13 years later. So, it's almost 14 in September. August, September will be 14 years. Wow. Yeah.
Wow.
Yeah. So when you started, what unit did you start in?
So our hospital breaks out the medical surgical individual units, and I started in post-surge.
Okay.
Yeah, my personality, me, JJ, my personality, and I was going through a lot of changes at the time also, and I just knew that starting in critical care was not going to be the best choice for me at that time. And so I started on post-surge, and for me, I am so glad that I did that and chose and made that decision to do that. I think that it gave me such a strong foundation. It allowed me to figure out how to be a nurse and how to be the nurse I wanted to be without having to add that extra layer of figuring out the critical care side of it on top of it. For me, that would not have been a successful path to start that I was doing that. And so, yeah, I was really glad that I did that and made that decision and spent those couple of years on that post-surgical unit. That unit at that time, we did, and still today, I guess, so many skills, IV starts, chest tubes, dressing changes, pain management. So much going on at that time, and drains of all kinds, right?
Right.
And so for me, that was a really, really good, valuable decision.
So
we start nurses in critical care straight out of school at our hospital and have really good success with that. Generally speaking, we have a really good process and onboarding program, and we have good success with that. But my encouragement is just to do your own little soul searching and decide for yourself, what is your path, and don't get caught up in what your buddy's doing or what you think is, what you think you might want to do because of a certain perception or whatever, but just to follow your path and be true to yourself, because that's where you're really going to blossom and develop and be the best that you can be.
Absolutely. And I think those programs that are implemented now versus what we had when we were being oriented,
right,
a couple of years ago, I think it shows to the progression of a hospital looking at where do we struggle? Like orientation is something that I know that we still struggle with and some of the different organizations that I've been a part of. But we're always looking at improving and making that better, making that transition from student to practitioner an
Right.
easier transition, and a better one so that it leads to more success. Let me ask you this, talking about this kind of being a second career and starting in post-surge and moving your way into critical care, knowing that was the trajectory, knowing that that was your path. What do you think, you had from your managerial past, right? That led you to be comfortable and be confident with following your path and not what your buddies were doing.
It was a very hard decision for me. I had some, and I don't know that that was um, that I don't know that that had anything to do with my previous career. I had some really good counsel at the time, and then
Who was that
just
inner circle? Who was that inner circle? Who was your counsel?
actually it was my it was my HR recruiter at the time.
Okay.
Yeah. She was a nurse actually. And you know what? Maybe she wasn't an HR recruiter. Maybe she was our, at that time, practice transition like coordinator. I
Okay.
think that makes more sense to me. Yeah.
Okay.
It was 14 years ago or 12 years ago that a few things have happened since then.
Sure.
But I worked with her, and then just, having some life experience, like I said, I was a little older whenever I went back to nursing school, and I just was starting to be able to, and it was a hard decision for me to feel like, um, I don't want to say I was taking a step back, but in order to take that side step, that is a hard decision to make, to know that I want to be in one area, but I'm going to take a side step to get there. That's a hard decision in general for people to make. And so I just really had to dig deep to have some peace about doing that. Um, but again, it kind of falls back to just that same peace that I was feeling whenever I decided to go back to nursing school. It was just like, this is what we're going to do.
Yeah.
And so you just kind of, it wasn't really even an adjustment. Like I said, it was hard, but it wasn't something that I necessarily questioned heavily,
Right.
because I just such a piece about that process.
I love that. I love that. It's almost like you submitted to your mind, like this isn't going to be weighing on me. I'm just going to let this go, and what happens happens. And I really, really appreciate that. So let's do this. Let's kind of switch gears a little bit. Let's talk about maybe a situation or a story that you can think about where a nurse and an RT came together to intervene for a patient that ended up in a positive outcome for that patient.
Absolutely. How do you decide, right?
There's a bunch, I'm sure.
I love being a part of interdisciplinary teams. I think it's so beneficial. But so something that comes to mind, it's been about a year or so, I think. So there was a patient on the floor, struggling, having a hard time. Our nurse wasn't obviously recognized the patient was deteriorating and not doing great, hypotensive, struggling with breathing. I think they were already vented, maybe for a day or so. I don't remember all of those details. But my nurse reached out to one of our experienced RTs. I think he was just happened to be on the unit, taking care of some other things. And reached out to him and said, Edgar, you're so good at this. You have so much experience. Can you just take a look at this and help us out? Radiology was there with the x-ray, and Edgar took a look at the x-ray, identified that there was a possibility that the patient had a pneumo. And so I think he actually went directly to the attending, didn't even talk to the resident, but just felt that certain that the attending needed to be involved as soon as possible. And so brought that to the attending. The attending was able to, it was on the night shift, so the attending had already left for the night. The attending was able to view that x-ray remotely and then come back into the hospital and get that chest tube placed. It was a pneumo. And so he was able to get that chest tube placed and re-expand and have a positive outcome for that patient in the end. So, I mean, who knows, without that interdisciplinary work and that teamwork between that nurse and that RT, I mean, who knows, right? Because it wasn't night, and it's difficult to get some of those resources as quickly as we would like to. So really like that story as far as how we work together.
That's so cool, because the nurse identified there was a problem immediately, right? They were the ones that found the problem. They communicated to who they needed to. They noticed that an RT was on the floor that they trust, that's experienced.
That right there, they trust, yeah.
They trust. So that speaks to not only nursing and respiratory, coming together and building a rapport with each other. It's not just like, oh, you've got all IVs and pumps, I've got all vent and airway. No. Right. Like, we are here together to take care of this patient. A good friend of mine says that nurses and respiratory should be like best friends. There's going to be times that you don't get along with your best friend. Yep. But for the sake of the relationship, for the sake of the patient, right? You do what's best, right?
Right.
So the nurse recognized that, found that RT that noticed that RT that they trust, right? Sounded like they were already in communication with somebody to get radiology, the rad tech on the floor to take that chest x-ray.
Right.
So they were already intervening, doing what they felt like they needed to do. And it led to just this team, this conglomerate coming together to do what was best for the patient. So, and then not only that, the RT and the nurse were able to communicate directly to the attending. Like, that's another relationship that was built, right?
It is, as not many attendings would allow that direct communication. And so you're exactly right. Yeah.
So that's a tip to the hat to everybody that was involved with that. It's really important to know what you can do and what you can handle, but it's also really important to know what you cannot, and to say, hey, I need some help. And
exactly.
For me, I don't want to speak for you, but for me, like, that shows more strength to say, hey, I need some help here. Yeah. Knowing who your resources are, knowing who you can reach out to is I would say a skill or a knowledge or an emotional intelligence to say, hey, I need somebody here. Can you come in and help me?
Right.
I love that.
Yes.
I love that. So in when we talk about this relationship and being best friends and how sometimes it's all IVs and pumps and airways and ventilators, right? What do we need to do to kind of bring these people together, to bridge that gap a bit?
Yeah, that's a good question. I think there's a lot of sorry, I have to pull this up right fast. Oops. I think that that's a good point, and it's not a natural. It's not, for some reason, that's not a natural relationship. I think from both sides, there is a tendency for both sides to say, like you said, this is my role and this is what I have control over, and I want to keep control over that. It's my patient, right?
Mhm.
Instead of saying, we have this patient that we need to collaborate on in order to get them improved, better outcomes, and get them healthy and back on track where they or need to be.
Right.
And so that it can be challenging to be able to bridge that gap. And so, one thing that we did together, JJ, is identified that it's not um, it's not just nursing that has the all the knowledge that can teach all the RTs. There are so many things in nursing school that we touch on as far as respiratory goes, but we don't have that in-depth knowledge that you guys do, and we need you. And one thing that we did together to help and bridge that gap was with my onboarding for new nurses, we had set up that RT day. Can you remember that? Yeah. And so I would have you come and teach all of my new nurses all about oxygen.
The history of it. They would
The
get the history
history of oxygen.
exactly.
No.
And they know it still.
Yes. Yes. And just talk about all things as far as, the progression from nasal cannula through ventilators. We would talk about ventilator settings and management and all of those things in order to help nurses have a stronger understanding, have a stronger appreciation for our RTs, and be able to start to build that team between the two disciplines. And so I think that while you were here, I think that that was a really, really good process that we had set up together. And I think the nurses really enjoyed it. And I do think that it was helpful in order to, like you said, bridge that gap and to help establish that little bit of a relationship, to be able to be a little bit more comfortable reaching out and saying, hey, can you help me with this?
Right.
Yeah.
So that's really interesting. I thank you for bringing up the RT day and the history of oxygen. We wouldn't have a fun show without a nice little jab at the history of oxygen from my sisters. But so
You're
I love,
fun.
I do love that. I truly do. Because it wouldn't be us without that whole backstory. But
Right.
so you talked about how we had the RT day, and this is
Mhm.
a totally different, on the same line, but a little bit different and not something that we put in our notes to talk about. Okay.
Uh-oh.
So prepare yourself.
Okay.
What could we do to flip the role so that the nurse or the nurse educator could help bring some knowledge to the RT? How could
Well,
we flip that around?
yeah, I think that we could do the exact same thing in opposite. Just, decide what topics that are valuable and good, and we could collaborate with that for sure. I think that there's absolutely, nothing wrong with building those relationships and expanding that knowledge base. I think that that's where we need to be rolling.
And now that I think about it a little bit more, whenever our respiratory therapists were being trained into critical care, I would have you come in and teach
Those
hemodynamics.
classes.
So it was a mutual relationship and a symbiotic relationship where we were pulling from each other, and I think that really helped build that rapport, and that helped bridge those gaps. And a lot of times the staff coming into those positions, whether it's a new or a seasoned therapist, it just puts another discipline in front of you so that you're able to kind of close that gap a little bit and build that best friend relationship. So Yeah, I really, now that I think about it, I used you too. um, um, one more question, and then we'll kind of shut it down, and we'll let you go celebrate the great Florence Nightingale's birthday. I wish we would have had a cupcake. That would have been really fun. No, I
That's enough.
told you not to bring one. That would be over the top, but that was a great idea. And you know what? To be honest, we actually had this planned for yesterday, but your idea of moving it today and celebrating her birthday, what is it, May 12th,
May 12th.
2021, right?
Mhm.
Celebrating her birthday and bringing in a nurse to celebrate Nurses Week and to be the inaugural episode of The Standard. I think it's just fitting. It just shows to where we need to go, like just elevating relationships across the board so that we can do what's best for that patient in the bed. And
And
I,
that's what it boils down to, JJ, is the patient in the bed. And how can we work together? How can we improve our practice? How can we help each other build each other's practice in order to improve our patient outcomes? I think that none of it matters unless we keep the focus on the patient.
absolutely, absolutely. I did have another question, but I don't know that we can top anything from what we just said there. Ultimately, that patient in the bed is why we do what we do. If you
Yep.
find that big global why and understand that and truly get that is why you do what you do for that patient, then the rest of it we just build and get better for that ultimate goal, for that why. I love that.
Exactly.
I love
Yes.
that. Thank you again for coming on, spending some time with me. I truly enjoyed it.
It was fun. Yeah.
Absolutely. And you were all nervous about this. This was fun. You said it. I didn't even have to prompt you, but awesome. Thank you again. Thank you.
Thank you, JJ. You have a great day.